For a general article on health in Italy, see Health in Italy. Healthcare spending in Italy accounted for 9.2% of GDP in 2012, of which about 77% is public, slightly lower than the average of 9.3% in OECD countries. In 2000, Italy's healthcare system was regarded, by World Health Organization's ranking, as the second best in the world after France. And according to the CIA World Factbook, Italy has the world's 14th highest life expectancy. Thanks to its good healthcare system, the life expectancy at birth in Italy was 82.3 years in 2012, which is over 2 years above the OECD average. History. After World War II, Italy established its social security system, including a social health insurance administered by sickness funds. In the 1970s, the social health insurance faced several equity problems as coverage differed between the sickness funds and around 7% of the population remained uninsured. Moreover, sickness funds went practically bankrupt by the mid-1970s. Due to growing public dissatisfaction with the existing healthcare system, Italian policymakers fostered a structural reform. In 1978, the government established the SSN, the Italian version of a national health service, including universal coverage and tax funding. National Health Service. Healthcare is provided to all citizens and residents by a mixed public-private system. The public part is the National Health Service, Sistema Sanitario Nazionale, which is organized under the Ministry of Health and is administered on a regional basis. Family doctors are entirely paid by the SSN, must offer visiting time at least 5 days a week and have a limit of 1,500 patients. Patients can choose and change their GP, subjected to availability. Prescription drugs can be acquired only if prescribed by a doctor. If prescribed by the family doctor, they are generally subsidized, requiring only a copay that depends on the medicine type and on the patient income. Over-the-counter drugs are paid out of pocket. Both prescription and over-the-counter drugs can only be sold in specialized shops. In a sample of 13 developed countries, Italy was 6th in its population-weighted usage of medication in 14 classes in 2009 and 5th in 2013. The drugs studied were selected on the basis that the conditions treated had high incidence, prevalence and/or mortality, caused significant long-term morbidity and incurred high levels of expenditure, and significant developments in prevention or treatment had been made in the last 10 years. The study noted considerable difficulties in cross-border comparison of medication use. Visits by specialist doctors or diagnostic tests are provided by the public hospitals or by conventioned private ones, and if prescribed by the family doctor require only a copay and are free for the poor. Waiting times are usually up to a few months in the big public facilities and up to a few weeks in the small conventioned private facilities. Patients, however, can opt for the free market option, provided by both public and private hospitals, which is paid completely out of pocket and has generally much shorter waiting times. Surgeries and hospitalization provided by the public hospitals or by conventioned private ones are completely free of charge for everyone, regardless of the income. For the planned surgeries, waiting times can be up to many months, especially in the big cities.